I have a question. Do you guys remember in Pharm we talked about loop diuretics? And I know it works on the nephrons and then that's another loop of Henry. But I've been having an issue recently about it, so do you guys want to explain it better for me, please?
So loop diuretics such as Lasix, also known as furosemide, they actually work in the kidney. And so here's an image of the nephron, and they actually work in the ascending loop of Henle. And this is actually where about 20% of your diuretic effect is going to occur, which is the area of greatest diuresis within the nephron. So you'll be able to get the most water out of the person in this area. When you take a closer look into what's going on in the cell, so here we have our loop of the ascending loop of Henle, and there's urine already in here. Normally you have a transporter that transports sodium, chloride, and potassium ions out of the urine so that the body is retaining those ions, and the water is moving along with that. So wherever those ions go, water will follow. With a loop diuretic such as Lasix, you are actually inhibiting the action of this transporter. So you are going to keep sodium, chloride, and potassium in that cell, and you will have accumulating levels of those within the cell, which will then cause water to follow, and so you will then excrete more water in your urine because you are retaining those ions in your urine. By getting rid of all that extra water, loop diuretics, they're indicated for patients that have edema in their periphery. Also pulmonary edema is also an indication, chronic heart failure, and of course hypertension, because we want to get rid of some of that excess fluid volume.
Talking about loop diuretics now, can everybody take this medication?
No, not everybody can take loop diuretics. There are some specific contraindications. The first one is anuria. That means the kidney is not producing any urine at all. There are also some conditions where you have to be cautious when you give loop diuretics. Those conditions include pregnancy, breastfeeding, and patients with diabetes. In diabetes, you don't want the patient to have a worsening hyperglycemia, because that's one of the effects of the loop diuretics. Then dehydration is also one place where a patient who has dehydration, you have to be cautious when you give the medication. Severe renal disease is also one of them. Ascites, that means collection of fluid in the peritoneum. Then patients with hypersensitivity to sulfur medications like sulfonamide and thiazide diuretics cannot take loop diuretics, and also hypersensitivity to loop diuretics itself. Okay, that reminds me, what are the pharmacokinetics and pharmacodynamics of this medication?
So loop diuretics are normally absorbed in the GI tract about 60 to 90% when given orally. Since it's protein bound, it can't go through the glomerulus, and it acts on the ascending loop of the nephron. When given PO orally, the onset is 1 hour and the peak is 1 to 2 hours. The duration lasts about 6 to 8 hours. For IV, the onset is pretty quick. It's 5 minutes, and the peak is 30 minutes, and the duration lasts 2 hours. So it's rapidly distributed and excessively protein bound, which is why it has to go through the ascending loop. And to be metabolized, it's partially metabolized or completely metabolized by the liver, except for furosemide, which is excreted primarily unchanged, about 50%.
We've heard from Shane about how loop diuretics are absorbed, distributed, metabolized. So are they excreted renally through the urine? Their pharmacokinetics determines how the dosages work. So there are factors when you are determining a dose of a particular loop diuretic. So I'll just give you a rundown of the 4 common loop diuretics that we have in the market. The most commonest one is furosemide, which is Lasix. So the normal dose for that is 20 to 80 milligrams. And then we have bumetanide. The normal dose is 0.5 to 2 milligrams. And torsemide is 5 to 20 milligrams. And itacranic acid is 50 to 200 milligrams. So sometimes if someone has a renal function problems like chronic kidney failure, you titrate the dose. If someone has congestive heart failure, you want to increase the dose between 40 milligrams to 80 milligrams. Age is also a factor that determines the dose. So if it's a kid, you want to do smaller doses. And if someone is older, you also want to consider that. the route of admission, if you're giving it PO or giving it IV, you have to consider the dose and the amount of effect desired. So this ties in with the severity of the volume overload. So if, let's say, a patient walks in, they are generally edematized, their put weight 30 pounds for the last 2 weeks, and you want to titrate the dose as per how much fluid you want this patient to lose within 24 hours or 2 days. So you don't want them to lose that fluid within a short period of time, and this puts them in a risk for hypotension and dehydration at the same time. Also, most of drug dosages are calculated according to their body weight, so that's a factor you also have to consider.
So that seemed like a lot. So what should we teach the patient about this drug?
You need to sit down with your patient and review some potassium-rich food the patient needs to add to their diets, because loop diuretics gets rid of a lot of potassium from the body, and we just need a fair balance. Also, when the patient is taking this medication, you need to warn them about some of the effects the medication have on the patient's severe reactions. You need to tell them about fall precaution, because fall precautions is very important. Lots of patients sustain injuries from fall. This medication causes orthostatic hypotension. So you want to caution your patient that whenever they are getting up from a lying position, they need to take it very easy, and they need to last for a couple of seconds because they don't want that orthostatic hypotension effect. Patients need to know that before they start doing hazardous activities like driving and some kind of fun games, you want them to watch out for the effect the medication may have on their CNS. Diabetic patients should closely monitor glucose levels and notify their prescriber about persistent hyperglycemia, because that's one of the effects of taking loop diuretics. Patients would also report skin changes, anything new, anything that's abnormal, anything that is severe. The patient wants to notify their prescriber and stress the importance of intake and output monitoring. Watch for evidence of electrolyte imbalance such as dizziness, headaches, and muscle spasms. After taking the medication for a while, you want to advise the patient to come back for follow-up treatment. In general, side effects from taking this medication includes decreased appetite, nausea, diarrhea, lactic acidosis, and metabolic alkalosis, which can be very life-threatening. You want to also tell the patients to take water during the day, like sips of water, because this medication can cause dehydration as a result of eliminating a lot of fluid from the body. So the patient wants to constantly be hydrated.
So as nursing students, what are some of the implications or things we should know about loop diuretics?
So for patients who are receiving loop diuretics, you have to closely monitor them, especially the older adults, because they tend to have a brisk diuresis. So you have to monitor their input and output as well, and also monitor for dehydration, because there might be any fluid or electrolyte imbalance. And you also have to monitor their vital signs every 4 hours or even closely as well, because they can have implications to that. You might have a perfectly normal patient, and before you go in, they might be in coma from dehydration or from the drugs they're taking. And also some lab tests that you can also do for loop diuretics is to obtain frequent blood count, to do serum and urine electrolyte tests. So you also check their burn, their carbon dioxide. You also have to check their blood sugar, especially for diabetic patient, because it can cause hyperglycemia as well. And check for diabetic patients, you have to monitor their glucose frequently, monitor their urine for any changes. If there's anything that seems odd to you, you just have to call the prescriber or the healthcare provider's attention. Thank you guys, that was very helpful. So I'll talk about the mechanical action of the drug and the drug class information. That really talked about what loop diuretic does and what impact it has on our kidneys and our nephrons. And also, Kichi here also talked about the indication and the contraindication of the drug use and letting us know what actually the drug does. And Damianos and Shana talked about the drug class, how it was absorbed, how it's being metabolized and excreted, and what dose we have to take, especially for kids, for those who are older and those who have complications. Then Ojoma here talked about the patient teaching, what we need to look for, what we need to teach the patients, the food they need to take, the food they need to avoid, some signs and symptoms they need to experience to talk to their doctor about it, and when to come back to the hospital to see their doctor. And I summarized it all by talking about the lab tests that we need to do, what we need to do before and after the person has taken the medication. So thank you very much, guys. That was really enlightening on what I wanted to know about you, loop diuretics. Thank you very much.
You are welcome.
You're welcome.
Kari?